Well, cuts and scrapes and burns happen to all of us, and most of the time we grab a Band-Aid and they heal nicely on their own. But if that wound isn't healing, it may need more medical attention, like specialized wound care. In this evening's Health Matters by Holston Medical Group, we share one patient's unique story of how this specialized care saved the day.
When he saw you, he had to do some removement.
Bryon Krantz is well known around this part of HMG Rehabilitation. He's been seeing Dr. Alan Meade for treatment of a wound on his hand.
It healed. It did great. After 21 visits, he did great.
21 visits because this wasn't just any wound. In fact, it was a first for Dr. Meade. Rewind back to August, a family vacation on Hilton Head Island. He and his son were fishing on the beach.
He caught a few shark and a couple of fish, and then he caught something big. And when he reeled it in, it was a stingray. And I went to remove it, and that's when it got me. It stung me through the hand.
2.5 inches into his hand. He went to the local emergency room for treatment, then saw his primary doctor. At first, it was healing well, but then things changed.
It just wouldn't heal. It just kept getting worse, and it scabbed over. So I came here to the urgent care, and then immediately the lady here said, no, if you don't leave and go somewhere now, we're going to lose your hand.
Bryon underwent orthopedic surgery, then was sent to Dr. Meade for wound care management.
He had to have the surgical part, and then finally had to have the wound care following the surgery because of the tissue and the venom. When I saw that for the first time, I thought, okay, it's deep. There's still some yellowish, brownish, necrotic tissue present that needs to come out. And then you don't know what's underneath, if it's tunneling, like if it's tunneling all the way up into the arm.
It was a lengthy process, but each visit brought more healing. Dr. Meade says in all his cases, education and working with the patient are crucial.
The key is education to this, too. You've got to really be able to educate your family members. They're your support.
Bryon is now left with a small scar, a big story, and a grateful heart.
Everything they did, they treated it wise, it was great. And I can't express how great they are here.
Now, Dr. Meade says if your wound isn't healing, if there are signs of odor, continued bleeding, or increased pain, it can be dangerous. He says it is important to get it checked. For more information on wound care management, please visit the Health Matters blog at holstonmedicalgroup.com.